Hi, I'm Abriti Arjyal and I'm working with Hurt International, a research organization based in Nepal. Within Rebuild, I co-lead Gender Equity and Justice Working Group and provide technical contribution to the qualitative and participatory research being undertaken in Nepal. The participatory action research and qualitative research that we have taken in Rebuild has helped the health system in fragile and conflict-affected setting to move towards a system that is fair and supports justice. We have learned that by involving community members, particularly marginalized and vulnerable population, along with health workers and stakeholders, we are able to identify social and structural barriers that shapes the access to health services. So further understanding the ground realities has helped the decision makers and planners to develop actions that are more inclusive and addresses the root causes. So overall, this entire process has helped us by bringing in the hidden voices to the discussion, understanding and acknowledging the structural barriers, and developing a more resilient health system. Across fragile and conflict-affected setting, one of the greatest insights that we have learned is that gender and intersectionality greatly shapes people's experiences and access to health services. Conflict and other crises often magnifies the pre-existing inequalities, and many individuals face overlapping forms of exclusion that limits their ability to achieve good health. So for instance, in Nepal, because of the prevailing gender norms, women often face limited mobility, increased caregiving responsibilities, and limited decision-making power that limits their access to health care. So when this further intersects with other factors like age, geography, and education, they create further barriers. So this creates further marginalization and vulnerability, which is not reflected in the routine data, and therefore the policies and plans developed are not informed effectively as it should be. The key lesson that we have learned is that gender and intersectionality should actually be integrated in all the stages of research, policy design, and programming. That is, in the initial design through data collection and analysis, and implementation and evaluation. It is important to understand the individual experiences and challenges of the people to develop a contextually relevant solutions for better outcome and the responsive health system. This means policies and strategies should be designed with an understanding of these layered vulnerabilities and informed by the evidence. In practice, this requires integrating gender and equity aspects and keeping community voices at the center of the entire process. So policies and actions should address the need of the population, particularly those who have been historically unreached and underserved. So further, the health system should adopt people-centered and participatory approaches by bringing in the community voices to inform the plans and the program designing. This participatory approaches and engagement not only increases trust but also enhances the accountability and shared ownership. In addition, it is also important that health system generates and analyzes disaggregated data and informs the decision and policies for an equitable and inclusive health system.